I'm Dr. Janine Bowring, naturopathic doctor, and today I'm talking about fasting and what is fasting. Certainly there are different types. There's some people who shouldn't fast, so I'm going to share that with you now. So thanks for tuning in, and please give me a big thumbs up. Be sure to share this video and turn on your notifications so you always get our newest and latest uploads all about natural health. So fasting, well, the history of fasting goes back to most religious practices around the world that consider fasting a fantastic part of increasing that spiritual connection. So something that is not new to most people, but perhaps you've not yet tried fasting. Certainly in today's day and age, a lot of medical practices are introducing fasting to their patients for the benefits of overall health. And there are some very specific reasons why you may want to fast. And I'm going to be covering those. I talked about all of them in the full 1-hour episode on this topic on fasting and intermittent fasting. So if you want the full episode, be sure to check that out on this YouTube channel. So fasting is a behavioral modification. And if you ask anybody who's fasted before, you know that it's a lot to do with that mind-body connection. And being able to now shift the body's glucose and lipid metabolism into a different facet of what it's normally doing on a day-to-day basis when you're eating, that's what fasting is all about. And certainly there's different types. So intermittent fasting is definitely in vogue right now, and it's something that is commonly practiced, and we'll talk about that in just a second. But also there's dirty or clean fasting. So dirty fasting, if you haven't heard about it yet, is when you can incorporate some coffee into your daily routine. And this is something that I enjoy doing when I do either intermittent fasting or a more prolonged fast. I find that this is what helps to get me through. Yes, I do love coffee. So if you're not a coffee drinker, I'm not suggesting that you necessarily take up a coffee habit. But if you love coffee, this is really a great tool that you can use to help you to get through. Also, clean fasting, so that would be mostly drinking just plain clear water. And I find this a little bit more difficult, and there are some natural things that you can add like lemon or cucumber into your water to make it more palatable, but that would be clean fasting versus dirty fasting with the coffee. Now there's different types of ways to name fasting, or intermittent fasting is also known as time-restricted eating. And typically what you would do is choose your eating window, and the most common is probably the 16-8. So 16 hours of fasting and 8 hours of eating. So a great example would be if you start eating at 12 noon, you can eat between 12 noon and 8 p.m. That's your 8 hours, and then you wouldn't eat anything. You would just have water or fluids without any sugar, nothing that's going to spike your insulin levels, and that would be your 16 hours. Another popular way of doing it is the 18-6, or even more regimented would be the 24. So 20 hours of fasting, 4 hours of your eating window. There's also alternate day fasting. So some practitioners will actually prescribe this for their patients, and you fast one day and then you eat a healthy diet the next day, and then you fast the next day and you eat healthfully the next day. And often in the fasting day, you're actually allowed to have some calories from some healthy foods, but usually it's a lower calorie diet. And this can be beneficial for different disease processes. Some people who can't do a full fast, so diabetics, of course, with the help of their practitioner, their doctor, are able to do the alternate day fasting. Now, then there are the prolonged fasts. So prolonged fasts are usually 24 hours or more. So it could be 1, 2, 3, 5, 8-day fasts, in which, and usually this is a clean fast, but some people like to do the dirty fast, and there are definitely benefits of doing this, but there are certainly some people who shouldn't be fasting, and I'm going to get to that in just a second. So give me a big thumbs up, be sure to share this video as you're watching, and share it with some friends who you believe might want to know more information about fasting and the benefits as to why it is so helpful. There's also something now called OMAD, so OMAD, which is 1 meal a day. And this is very popular amongst people who are getting into fasting. And you're allowed to basically eat one healthy plate of food within 1 hour of the day, and then the rest of the day you are not eating. You're just having your water, or if you're doing the dirty fasting, you're having your coffee or tea. Herbal tea is fine as well. So that may be a way to, again, get into the fasting routine. I know some people who do OMAD and have for, a period of months and months and months. I'm not sure if I would recommend that. It's certainly along with, doing the fasting and taking days when you're not fasting, I believe is the best way to go about fasting. So you're taking little breaks from that fasting so you don't down-regulate your metabolism. And there's something else called fasting mimicking diet. So sort of tricking your body into thinking that it's fasting. And this was popularized by Dr. Longo, and it's usually a higher fat, lower carb diet and moderate amounts of protein. And basically you're calorie restricted for about 5 days, and which helps you to get into autophagy, which is your body's cleanup mechanism. We have another video on that. At about day 3, you're going to go into that autophagy. And usually in the fasting mimicking diet, you're in a ketotic state. So you're influencing your liver metabolism, you're living off of ketones, and basically you're burning that body fat. So this might be something of interest to a lot of people. Certainly I've not yet tried this one yet myself, but I will let you know how it goes. If you've tried it, please leave your comments below. I'd love to hear how that went for you. So certainly not everybody should fast. And who shouldn't fast? Well, pregnant women, nursing women as well. If you have a certain health condition, this would not be recommended. For instance, diabetics, if you're medicated for diabetes, although it is possible, but this is something that you definitely undergo with your doctor. Now, there's another group of people that should probably not start with fasting, and that is if you are leptin resistant. So leptin is called the stop eating hormone, and this is something that you may not realize if you're leptin resistant. Leptin, the word is Greek, comes from the word leptos, meaning thin, and basically your fat cells will trigger this hormonal release of the leptin, which goes up to the hypothalamus of the brain. And in the hypothalamus now, what's happening is it receives that message then from the leptin, and this then has a further cascade of hormonal release to help to stop you from eating. And that's essentially why we have the leptin. Now, what happens over time, if you're overweight, you've got a lot of fat cells, your fat cells are secreting a lot of that leptin to the brain, and you can become resistant to that signal. And the hypothalamus kind of says, no, I'm not going to pay attention to you anymore. And what happens then is that that signal to stop eating is not happening appropriately. So what happens is you tend to overeat, and again, that cascade of what happens for our metabolism with our other hormones is compromised. So certainly if your leptin signaling is off, then the benefits of fasting will not be maximized. So it's something that I would always say, make sure that you get your leptin sensitivity where it should be. And we'll have a future video on how to do this to help you, but you've got to have that proper balance between your leptin and your other hormones in the brain to be able to make sure that you can maximize those benefits of the fasting. So thanks for joining me today. This was all about fasting, and leave your questions and comments below, and be sure to give me a thumbs up and follow me for future videos.